What can you do for bone-on-bone knee pain? Are there alternatives to surgery, or will you end up needing a total knee replacement? The short answer is that there are alternatives. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what some of those alternatives are, as well as how to know if you need a total knee replacement. So first of all, let's just describe what exactly bone-on-bone knee pain means, because there is a lot of misunderstanding around that name, and it's kind of a frightening name. Knee arthritis is graded from grades of 0 to grade 4, with grade 0 meaning no arthritis, grade 1 being doubtful arthritis, and then grades 2, 3, and 4 being mild, moderate, and severe arthritis. And grade 4 severe arthritis is the same thing as what's known as bone-on-bone knee pain. Now, when you hear the term bone-on-bone knee pain, it really makes you think that there's nothing left between your knees. But that's usually not the case. Grade 4 knee arthritis means that there's severe joint space loss, not necessarily the entire joint space loss, but severe joint space loss, as well as hardening or sclerosis of the subchondral bone and a deformity of the bone that's underneath the cartilage. Now, that can be in one compartment of the knee, or it can be in multiple compartments of the knee. You have the medial compartment on the inside of the knee, the lateral compartment on the outside of the knee, and then the patellofemoral compartment between your kneecap or patella and your femur. Now, if you just have grade 4 knee arthritis in one compartment, it's very likely that you may be able to continue to function and do your everyday activities with probably a little bit of discomfort, but you'll be able to do them without needing surgery. If you have severe arthritis in all three compartments, your odds of needing surgery may increase, but the truth is nobody ever needs knee replacement surgery. It's an elective surgery and you can live without it. For example, a cardiac bypass, if you want to continue living and you have a heart attack, you will probably need that. But the choice of whether you have a knee replacement is ultimately up to you. And if you can find ways to continue to do the things that you need and want to do without being limited by your knee pain, then no one can tell you that you need a total knee replacement. So here are a couple alternatives to having a knee replacement and things you can do to continue to function without needing a knee replacement. First of all, one of the most widely studied and most effective treatment for knee pain is exercise. And granted, I am a physical therapist, so that is my bias, but exercise for knee arthritis from mild to severe grades has consistently been shown in research to improve function, improve pain, and can even affect structure of the knee. Now, what type of exercise should you be doing? There's no one particular exercise that's going to fix bone-on-bone knee pain, but most of the research is centered around weight-bearing aerobic activity. For example, walking. But that's a catch-22 for many people who have bone-on-bone knee pain, because walking is usually one of the activities that bothers people the most. Now, walking in the water is a great way to unload your knee if you have access to a pool, because the buoyancy of the water helps unload your body weight and makes you functionally lighter. That way you don't have as much force going down on your knee, and so there's not as much compression down on those cartilage surfaces every time you take a step. And to that end, weight loss is another very effective alternative for bone-on-bone knee pain for the same reasons. The less weight you're carrying here, the less pressure there is on your knee joint. That weight gets magnified over your knee joint up to 4 times. And so decreasing your body weight, particularly abdominal fat, can help decrease the pressure on your knee joint. Now, there are some devices that will allow you to walk more comfortably with bone-on-bone knee pain as well. Using a cane, a rollator walker, or a knee unloader brace also help take pressure off the knee so you're not bearing as much weight down across the arthritic joint surfaces. I've got separate videos for how to use a cane on this specific knee unloader brace and how to use a rollator walker. And I'll link to those in the cards at the top right-hand corner of this video. But many people are hesitant to use a cane, a rollator walker, or a knee brace because they think it'll make them look old. And if you're going to be having a knee replacement, having a part of your body cut out, who cares what other people think? If using a rollator walker or a cane will allow you to get around more comfortably and do the things that bring value to your life, it's probably okay. And the truth be told, if you're limping around because you're in pain, you're probably going to look old anyway. Your friends and family will be much happier if you're able to go out and do things with them, and nobody besides you is probably going to care about the fact that you're using a cane or a rollator walker. Now, strengthening exercises can also be helpful if you have bone-on-bone knee arthritis. Earlier, we discussed the different compartments of the knee, the medial compartment, the lateral compartment, and the patellofemoral compartment. And usually it's the medial compartment and or the patellofemoral compartment that get most affected by arthritis. Now, weakness in your hip muscles or in your glute muscles can contribute to more side-to-side motions and put extra force across the medial compartment and lateral compartment. So it is important to help strengthen your glutes, particularly the muscles that help you stay balanced on one leg. Because your knee is meant to bend back and forth this way rather well. But when you're grinding on those joint surfaces from overpronation like that, that shears the cartilage and contributes to wearing the cartilage down. So strengthening your glute muscles is incredibly important. And I've got some other exercises that I'll also link to up in the cards in the top right-hand corner. Furthermore, strengthening your gluteus maximus, your butt muscles, is important to help take pressure off your patellofemoral or kneecap joint. Being over-reliant on your quads, for example, squatting with too much pressure on your toes, increases the compression behind the patella and puts more pressure on the cartilage on the back of the kneecap. Conversely, using your glute muscles or your butt muscles to sit back when you're squatting, keeping weight on your heels, uses more of your glutes and takes some pressure off of the quadricep muscles and the patellofemoral joint. So those are exercise interventions for bone-on-bone knee pain. And as a physical therapist, again, that is my bias, but they're also the least invasive and least expensive, or in many cases, free treatments that you can use to decrease pain and improve function when you have bone-on-bone knee pain. Now, what about other things like cortisone injections or platelet-rich plasma or PRP injections? Well, cortisone injections can be helpful in the short term if you're, say, going on vacation and you need a temporary bout of pain relief. However, they can damage the knee joint if you have them too often. So I would probably reserve those for times when you need short bouts, a couple weeks or a couple months of pain relief, but not to have to rely on them over and over and over for months and months on end. Now, what about PRP or platelet-rich plasma? That's an upcoming treatment in the field of regenerative medicine, and there is some promising results behind them. But in a recent meta-analysis in 2022, they found that platelet-rich plasma or PRP injections are not superior to other interventions for knee arthritis, including cortisone injections, hyaluronic acid injections, saline injections, or exercise therapy. Now, ultimately, the choice of whether you need or want to have a knee replacement is up to you. Your doctor or your surgeon or your physical therapist or me can't make that decision for you. It's your choice, but there are a few things I want you to take home from this video. Number one is just knowing that because you have bone-on-bone knee arthritis doesn't necessarily mean that there's nothing left in your knee at all. And so it's probably better to refer to it as grade 4 knee arthritis. Second, there are conservative treatment options available, but those options aren't going to be the same for every person. So I would encourage you to explore your conservative treatment options, seek out help from a skilled physical therapist, And just know that you can always go and have the knee replacement later. But once you have it, you can't undo it. And furthermore, there are about 20% of people who have knee replacements who aren't satisfied with their results. Now, if you are in the St. Louis area and you'd like to explore your options to avoid knee replacement surgery, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else, we've got lots of other videos on how to relieve knee pain conservatively, and you can check those out in the playlist over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.